Hello guys, hello everyone. Hello everyone. How are you? How are you? I'm just waiting for everyone to join up. Hello my dear friends. Hope all of you are fine and hope all of you had a wonderful exam yesterday. Yes, I do understand that exam was a bit tougher, moderate to tough. Let us just quickly wait for some time so that everybody can join up. Yes, beta. Hello everyone. Prachi, thank you so much for messaging. Thank you so much. Shreya, thank you. Good evening, everyone. Yes, good afternoon, good evening. Yes, let us just wait for 2 3 minutes so that everybody can join and we can have a session with the discussion from your side because without your feedback, without your approval, I mean, the questions and the answers cannot be marked correct, right? So, just allowing some time for everyone. Sayed, thank you so much, beta. Yeah, just allow me some 2 3 minutes time so that each and every one of you can join, beta. I hope I'm audible and I'm visible crystal clear. Hope there is no confusion in this. Okay, let us quickly see. I'm hoping all of you, I'm also checking my phone along with this so that all of you are able to join peacefully or not. Yes, good evening. Anurag, thank you so much. Okay, so let us quickly go ahead and let us try to. I believe all of you would have got the link and all of you are able to see it live, right, beta? Oh, क्या बात है. Actually, I did not. Prachi, thank you so much for this feedback. Actually, I did not include this in the list of the questions that I will be showing because none of the student actually shared this thing with me. That same gas geyser story that we had discussed in the class had come. Okay, so one more question. Yes, we can add to our arsenal. Yes. So without wasting time, beta, with whoever you are present right now, so let us go ahead with the session, beta ji, and let us quickly discuss the first MCQ. Good evening, Avinash. Good evening. Good evening. Good evening. Good evening. Yes, so gas geyser question. Okay, I will add that. Thank you so much. So number of questions increases further. Yes, actually the paper one, to be honest with you, was a little bit of the on the bouncer side because many of you were expecting that plain, flat, direct questions will be there from the paper one. Luckily, from biochemistry, the level of the questions this time was actually easy, and I hope, like how I say in my classes, in the paper one, definitely biochemistry will make you pass. Now, how you have done in paper 2, that will decide the whole story, but I believe you would have definitely done enough to crack the exam in this attempt itself, better. So without wasting much time, let us try to go ahead and discuss on the first question that I'm going to show you over here, better. And I believe all of you will agree with me that yes, this question was there. Okay. Yes, urea cycle. I will discuss. I have some questions on the urea cycle. Teen questions. I have urea cycle. Only two questions, beta, that I will show you. Yes, in case you recall something, you can also share it with me in the chat section. Okay. Vitamin deficiency most likely to cause the lactic acidosis. So those of you who are present, you can just tell me the answer quickly because usually these recall sessions we try to make as much as interactive as possible, right? So that yes, waiting for your answers, better. most likely to cause the lactic acidosis. Lactic acidosis, I believe all of you would have definitely got this one question correct, beta. This was discussed multiple time in our classes, that all of you recall that we had talked about pyruvate to acetyl CoA, and yes, pyruvate to acetyl CoA conversion, link reaction, PDH complex, 351 combo, 3 enzyme, 5 coenzymes, and the 1 cofactor. Out of those 5 coenzymes, the most important one was beta vitamin B1. So in absence of vitamin B1, my dear friends, pyruvate will not be able to convert it to acetyl CoA, and it will be mainly converted to which one, beta G? Lactate. This is the same concept we also have studied during the Wernicke-Korsakoff syndrome management. We should not never ever give the glucose first. We should always try to give the vitamin B1 to be corrected first by slow IV push. Then you can give the glucose load. That is the same concept, because pyruvate to this, yes, all of you are right, beta G. The answer of these questions will be beta thiamine. Without any doubt, I hope all of you have got this one correct. Just a quick recap from our notes. We have talked about this link reaction, pyruvate to acetyl CoA. You remember the PDH complex 351 combo. Out of the 5 coenzymes, we have discussed in the classes that B1 or thiamine is the boss. Thiamine pyrophosphate is the boss over here, beta. Hope you have got this one question correct, and 1 mark guaranteed in your exam when the results are out. Okay, coming to the next question over here, beta G. Second question. Second question was a bit tricky, but it was actually from the notes that we have discussed during the classes, beta. ये point हम लोगों ने discuss किया था. कोई बात नहीं, डॉक्टर बेस्ट, नथिंग टू पैनिक. Do not think that you are inferior or something like that, or you have not been able to understand the language of question. I totally believe that you would have done enough बेटा. आपने जरूर जितना जरूरत है उतना जरूर आपने करके आए हो, और आप पास होके ही आओगे बेटा. इतना पैनिक होने का कोई जरूरत नहीं है. Yes, was actually bit a bouncer, but honestly beta, biochemistry will save many of the students, those who had followed our missed workbook notes. प्लीज रिमेंबर, बहुत सारे क्वेश्चंस आए हैं एज इट इज फ्रॉम द मिस्ड वर्कबुक. दैट्स व्हाई आई एम आल्सो शोइंग द स्क्रीनशॉट ऑफ द वर्कबुक पेज सो दैट यू कैन रिकॉल. यस, इट वाज देयर. नाउ आंसर ऑफ दिस क्वेश्चन बेटा, दोज ऑफ यू हु आर प्रेजेंट, you can just make an attempt. Yes, there was a question on this sickle cell anemia, right? And most appropriate management for this sickle cell anemia, my dear friends, try to understand. Answer of this question. Answer of this question beta, एक attempt करते हैं. We have discussed this. Once I show you the page, we had discussed this exact question, and I told you that usually we have to choose the answer for sickle cell anemia as hydroxyurea beta. Remember our 2-3 BPG shunt discussion. Let me show you the page from where we have discussed this. Please remember beta, hydroxyurea question. Let us remember, we had discussed one special pathway in the RBCs, this BPG shunt pathway, where we have discussed about this one of the fantastic guy that is known as beta 2,3 BPG. And in the 2,3 BPG, we have discussed some conditions which are going to increase, and we have also discussed the conditions which are going to decrease. And if you recall, my dear friends, during the classes I told you that please do not miss this. I had put 2 star mark over here. And remember beta G, during the management of the sickle cell anemia, hemoglobin S, we usually give some drug called as beta hydroxyurea, and this hydroxyurea can increase the concentration of the hemoglobin F. This we had discussed during the classes, but if you recall, will please remember beta, please remember. So hydroxyurea is an important point that can increase the hemoglobin F. So in patients of sickle cell anemia, as the oxygen carrying capacity of the blood is going down, you try to increase it by hemoglobin F. Comparing with hemoglobin S, hemoglobin F has got more oxygen carrying capacity beta. That's why we can indirectly go for increasing. Remember, we have also discussed about one more condition called as HPFH. That did not come, hereditary persistence of fetal hemoglobin. That was one more thing that we have discussed during the classes, right? So please remember, hydroxyurea was there as a question. And what about the other options? Please remember, immediate blood transfusion is actually required only in case of acute emergency beta. यहाँ पर कोई acute emergency तो है नहीं. Here there is no acute emergency, so this cannot be the answer. Please try to understand, in case of sickle cell anemia, iron supplementation is not actually advisable. It might lead to iron overload. That's why iron supplementation with folic acid is not required over here. But vitamin B12 has got no correlationship over here, so we can also rule out this guy. And please remember the answer by the method of exclusion that we can also choose. It is going to be beta hydroxyurea. It is going to be beta hydroxyurea is the safest answer that we can mark it over here. Hope you have all got this one correct, beta. Right. Please remember this. So hepatosplenomegaly, lethargy, fatigue, hemoglobin electrophoresis, HbS, sickle cell anemia management, they had asked beta. This we had discussed during the classes. I also showed you that point. Moving to the next question, third. Yes, this was also taken directly from our 25 most important YouTube live session. We had discussed this beta. क्वेश्चन को एक बार देख लें. एल ग्लूटाथायोन was also in the option. Mani, thank you so much. I will also include that. Thank you so much for the feedback, beta. So for that sickle cell anemia question, L glutathione was there in the option. I will also write it. Otherwise, I may also forget later. So you are telling that there was also mention of L glutathione over here. We'll try to include this. Okay, coming to the next question, beta. इसको एक बार देख लेते हैं. This was taken directly from the 25 YouTube live session. 25 most important YouTube live session. I hope some of you would have definitely got this one correct. Yes, so in this case we are having some 46-year-old, just a moment beta, 46-year-old with multiple polyps. So there is a history of polyp over here, beta ji, and in this case just a moment. Yes, yeah, I hope you are able to see. Yes, so in this we have discussed, it is a case of hereditary non-polyposis colony cancer, beta, HNPCC. And point to be noted, we have also discussed some DNA repair mechanism defect. Please remember, nucleotide excision repair defect leads to a something called as xeroderma pigmentosum that we had also discussed earlier, beta. Xeroderma pigmentosum we have discussed. Base excision repair, my dear friends, other disorder, double strand break disorder or some other disorder, but here the answer is, my dear friend, mismatch repair. We had also heard about this. In short, people call it as MMR, strand directed mismatch repair is the reason for this HNPCC. Hereditary non-polyposis colony cancer is also called as Lynch syndrome, LYNCH, Lynch syndrome. We had also discussed during the classes, beta. So please remember, mismatch repair is the answer of the third question over here. Mismatch repair. Yes, here is the PowerPoint that we had also discussed during the classes. NER, xeroderma pigmentosum or trichothione dystrophy. HNPCC, non-polyposis colorectal cancer, Lynch syndrome. Base excision repair is Muti syndrome, beta. And strand directed mismatch, double strand break repairs was also something we have discussed about Bloom syndrome and the other. Here our answer was HNPCC, MMR defect, mismatch repair defect. Please try to remember this point, beta. Okay, going to the next important question. Next important question, beta. Next important question, beta ji. 32-year male presents with OPD with eruptive xanthomas, beta. Eruptive xanthomas. Yes, again we have heard this word in our notes. Deranged lipid profile showing high triglycerides, and please remember high VLDL level. TAG and VLDL, we have also discussed. The VLDL is the nothing but endogenous TAG. And cholesterol level, whether here was normal. Some of you said that cholesterol level was not mentioned. Some of you said, sir, cholesterol level was normal. Basically, it is secondary to the rise of the level of the chylomicron, beta. It is a case of type 1 hyperlipoproteinemia. Chylomicron syndrome is the other name of that. Hope you have got this one correct. Question came on enzyme deficiency, beta. Here the answer will be the B, lipoprotein lipase. Lipoprotein lipase. आपको याद होगा, we have discussed that this is an important question, beta. LPL, lipoprotein lipase. LPL, lipoprotein lipase. Important point. Try to understand this, beta. Lipoprotein lipase. Yes. LPL deficiency. Ocryl. Okay, we will discuss. No matter, whenever you remember something, yes, lipoprotein lipase, this is a question that we have discussed during the classes, beta. Remember, LDL receptor deficiency is actually called as type 2A. This is our type 2A. Type 2A lipoprotein lipase deficiency beta, it is our type 1. Type 1 hyperlipoproteinemia. Hormone sensitive lipase deficiency or cholesterol ester hydrolase deficiency, these two, my dear friend, both of them leads to another disorder called as Woolman syndrome. We have also discussed this during the classes. Remember, Woolman syndrome or Woolman's disease or Woolman syndrome. It was another question beta. Here the answer will be for type 1 lipoprotein lipase deficiency. We have discussed this during the classes. Remember the topic, that type 1 hyperlipoproteinemia, Frederickson-Level's classification, chylomicron syndrome, increase of level of the chylomicron, TAG level will be high, and once the TAG level is high, my dear friends, TAG is the precursor of our VLDL synthesis from the liver, so VLDL also will be high. Lipoprotein lipase or ApoC2 deficiency, here in the option lipoprotein lipase was given as the answer. Hope you have got this one correct. I told you these two disorders are very important. They might have asked question on the type 2A, and they might have definitely type 1 chylomicron syndrome. Please remember this area for only two that we have discussed image based questions. Eruptive xanthoma was mentioned. This was also discussed during our classes, but exactly what we discussed also came over there. I hope all of you would have got this one correct. Type 2A is LDL receptor deficiency. हमारा क्वेश्चन था chylomicron syndrome. Okay, here some conceptual new question they have asked beta. Please remember colored tube for using coagulation studies beta. Coagulation studies, my dear friends, marking it in blue color because the answer of this question is actually blue. Coagulation studies के लिए remember coagulation profile test basically prothrombin time, activated partial thromboplastin time, and my dear friends, cholesterol was not mentioned in the question. I will correct it. Thank you so much. And we also check something called as international normalized ratio, INR. Coagulation studies are mainly checked by the blue color tube beta. Red color tube is clot vial. Green color tube is heparinized one. Heparin जिसमें देते हैं. Lavender, my dear friends, it is the EDTA tube that can be used for other hematological purpose. But for blue, usually during our classes we have discussed call about gray color tube for the glucose, plasma glucose or plasma lactate estimation. But this time the question came from coagulation studies. Please remember it is the blue color tube. Blue color tube was asked as a question. Cholesterol was not mentioned over here. Cholesterol was not mentioned. Okay, I will remove this point beta. This was not mentioned. This was not mentioned. Thank you so much for the feedback. आगे बढ़ते हैं बेटा. Blue color tube for coagulation studies. Okay, now next question. Next question. I hope all of you would have got this one correct. It is an overlapping question. Remember beta, basically they have asked about which one? Marfan syndrome over here beta. This is a question on the Marfan syndrome. Okay, इसको देख लेते हैं बेटा. Long limbs, arachnodactyly, hypermobile joints. Please remember high arm span, high arched palate. Please remember. Oh, clinical case, money. Thank you so much. There was a question on clinical case. Okay. APTT is increased in question. No, I am asking for I just showed you the question for colored tube. I believe this was a question that has been also asked in your exam. Colored tube. Which colored tube we use for the coagulation studies? And the answer of this question was blue. APTT separate question. I think hematology will be the best subject to pick it up for. Okay, this question beta, 22-year-old male, routine health checkup, long limbs, arachnodactyly, high arm span, high arched palate. Basically, these are pointing towards the Marfan syndrome. From Marfan 2 question came beta. From Marfan 2 question came, and please remember the most likely cause over here will be the fibrillin gene mutation beta. Fibrillin 1 gene mutation. The best answer over here you will mark it as fibrillin 1 gene mutation. Collagen mutations, we have different disorders: type 1 osteogenesis imperfecta, type 2 chondrodysplasias, 3 and 5 Ehlers-Danlos syndrome, 4 Alport syndrome, like that. Elastin, my dear friends, elastin mutation can actually lead to another syndrome called as Williams syndrome beta. It can lead to something called as Williams syndrome. That is usually PG level topic. We do not discuss this in our FMG classes beta. Williams syndrome, elastin mutation beta ji. where we have also some features of multiple myeloma common, like hypercalcemia is also common over there. Williams syndrome hota hai beta. There is also aortic stenosis, mainly is basically the supravalvular aortic stenosis. We also have elephant like noses, like that. Williams syndrome is, that is due to elastin mutation. Here the answer of this question will be beta fibrillin. Marfan syndrome, I would have got this one correct. Okay, so there was a question on crystalline diaper. I will also include that. So two more new question, my dear friends. क्या बात है? Two more new questions. Okay, thank you so much, beta ji. Two more new question over here that we should remember. Okay, thank you so much, beta. Important, yes, these two question I had not included. I will definitely include that, beta. So option number D, if anybody recall later on, please you can share it with me, beta. Here the answer was this. Remember, there was also one more question on the Marfan syndrome over here, beta. I believe they would have also cooked up some stories. Marfan se do question aaye the, beta. And remember, I believe they would have given some history like long limbs, arachnodactyly, same type of history would have been also given over here. Hypermobile joints, 2D echo might have shown mitral valve stenosis, eye checkup, subluxation of lens. Subluxation of the lens was actually mentioned, and few students also reverted back that fibrillin 1 gene mutation was also there. Okay, I can totally understand the scenario, beta, that questions were actually lengthy, and to read the question many of your time would have been wasted. Yes, I totally immense and tremendous sympathy for all of you, but I am strongly believing, I have immense belief in all of you, beta, that definitely you would have done required number of MCQs correct to pass this exam. Yes, this time the exam was little bit on the harder side, beta. Paper 1, which is usually believed to be one of the easy work, cakewalk, but this time it has given you multiple twists and turn. But I strongly believe, and I'm praying to God for all of every one of you, that definitely you shall be coming out with flying colors once the results are out, better. Thank you so much, thank you so much, and definitely it will happen. So this question, fibrillin 1 gene mutation, beta g, here it is a straight cut question. Diagnosis was actually the Marfan syndrome over here. Ehlers-Danlos loss, homocystinuria, osteogenesis imperfecta. These are some different type of scenarios over here. Fibrillin gene mutation. Okay, I am talking about fibrillin 1 gene mutation. So mainly they have cooked up some stories like this. Different students shared with different type of history. So whatever the options they had given, beta, so please try to remember. So Marfan से दो क्वेश्चन आए थे, उसको एक बार देख लीजिएगा. Marfan syndrome, I hope all of you have got this one correct. From urea cycle, yeah, urea cycle questions I will show you later, beta. I have included that at the late portion. Hyperammonemia type 2, those questions will come. Okay, coming to the next question, beta. This question, my dear friends, it was asked in day before yesterday's exam, and it has been picked up directly from our missed notes. Chapter 1, enzymes, my dear friends. We had talked about some gene mutation, and please remember, my dear friends, I hope you would have all got this one correct, beta. This was taken directly from our notes. Amyotrophic lateral sclerosis. If you don't believe me, then please try to remember. Then also try to remember exactly, taken a page from our workbook. We have talked about this extra. I put star mark over here. SOD gene mutation, my dear friends. Amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. We have also discussed about the story. Famous baseball captain of USA baseball team who died due to this disorder, amyotrophic lateral sclerosis. They have given SOD1 gene mutation. Yes, SOD different type of gene mutations are possible, but at least SOD was mentioned only in one of the option. So directly, those of you who had followed page number 14 of our biochem workbook, beta, direct question on this SOD gene mutation, star mark दिया हुआ था. Try to remember this. Do not miss this, beta. FMR1 gene mutation, Fragile X, CFTR cystic fibrosis, HTT, it is beta Huntington's chorea, Huntington's syndrome, beta, Huntington's syndrome. So I'm not writing those. All of you although note this, but please remember option D is Zindabad. Plummer Vinson, we did not teach in the classes, beta. Some other subject would have definitely talked about this. Okay. ओके, क्या बात है, इस बार ऑप्शन डी मार्क करके चलो कोई बात नहीं. Okay, SOD1 gene mutation was the answer. Yes, I hope all of you have got this one correct. Okay, SOD1 gene mutation is the right answer of this question. Dot. Thank you so much, beta. Okay, okay. Another expected question. Chapter 1, topic number 1. First day class missed. Please try to remember. We have discussed multiple questions. Day 1 has given us lot of questions. Those of you who have gone through that enzymes chapter notes, my dear friends, you would have got many questions in day before yesterday's exam, beta. I hope all of you have got this one correct. Yes. Try to remember classical things that we have discussed. Tremor, my dear friends, some jerky movements, difficulty speech, behavioral changes. We have also talked about mood swings in male in case of Wilson disease, hepatosplenomegaly, golden brown ring at the limbus of the cornea on slit lamp examination. It is a case of Wilson disease. Question came on best investigation, beta. My dear friends, during the classes I told you multiple time, best का मतलब होता है gold standard. Investigation of choice and gold standard are two different things. These were my words multiple time during the classes, beta. Please remember, always I told you, if this best or gold standard word is asked in the exam, then we have to go for the option as liver biopsy. Liver biopsy is the gold standard, and in liver biopsy, basically what we check, beta, we go for hepatic copper quantification. Hepatic copper, yes, this is the exact word which was given on the exam. I hope all of you would have got this one correct. Gold standard. But investigation of choice, normally what we do in our real life practice, then the answer would have been marked as 24-hour urinary copper. Then, my dear friends, the third best answer can be marked as serum ceruloplasmin. If you ask me the order over here, C will be greater than B, will be greater than A. My dear friends, we have discussed this during the classes CBA. Many of you also before the exam had put a message to me, okay, sir, if this question comes, how should we approach? And I hope all of you have got this one correct. Sure short question, beta. Expected question area, Wilson disease, my dear friends. Wilson disease, please remember. ओ, गोल्ड स्टैंडर्ड वॉज मेंशन्ड. अरे बाप रे, क्या बात है. तो यही तो वर्ड था. एग्जैक्टली शोइंग यू फ्रॉम आवर वर्कबुक पेज, बेटा. विल्सन डिजीज के लिए हम लोगों ने 1 घंटा स्पेंड किया था क्लास के अंदर. पेज नंबर 13 ऑफ आवर बायोकेम वर्कबुक. देयर वी हैव टॉक्ड अबाउट विल्सन डिजीज. इन द डायग्नोसिस, माय डियर फ्रेंड्स, urinary is better than this one, but gold standard we should go for liver biopsy, where we should check for hepatic copper. Hepatic copper means inside the liver the deposition of the copper. That's what is given in a different word over here, hepatic copper quantifications. Plain for straightforward question, and I hope all of you have got this one correct, beta. Wilson disease, I hope all of you. KF ring, although this KF ring image did not come, few of you also talked about some sunflower cataract image. Let me show you one more question that came from the Wilson disease, beta. Yes, another question number 10 also from Wilson. Wilson से 2 क्वेश्चन था, मार्फैन से 2 क्वेश्चन था, पता नहीं. This time same topic, multiple question has been asked. Urea cycle disorder, 2 question. Marfan syndrome, 2 question. Wilson disease, 2 question. Please try to understand. Same topic, more than 1 question has been asked. What about this? Okay, chalo, Dr. Nazrul, Dr. Mani, no matter whatever the language they have used, beta, the answer will remain as हेपाटिक कॉपर. बेटा, लिवर बायोप्सी में हेपाटिक कॉपर को हम लोग देखेंगे. ये चीख चीख के बोला हुआ था. रियल लाइफ में बहुत सारे क्लिनिशियंस इसको करने से प्रिवेंट करते हैं. दे डू नॉट डू इट, बट प्लीज रिमेंबर ऑन द एग्जाम पेपर, माय डियर फ्रेंड्स, सम थिंग्स वी शुड remember for our exam, not for our real life. Please try to remember. Those are the words that we have discussed during the classes. Okay, ये क्वेश्चन था कि नहीं था? This was a question, my dear friends. Few of you told that in this question some 2 images were given. 2 images on a question of Wilson disease. I don't have the exact options, but I believe this sort of options were given: cirrhosis bulbi, chalcosis bulbi. Basically, they had talked about following eye changes. Sunflower cataract word was mentioned. Okay, I will correct it. Sunflower cataract word was mentioned. Okay, ठीक है. This word. So this image was not given, but many of you actually told me they had given some 2 images on a question on Wilson disease. विल्सन डिजीज का एक ही क्वेश्चन में दो इमेजेस था. सो सनफ्लावर कैटरैक्ट व्हाट, टोटली डिफरेंट क्वेश्चन. ओ माय गॉड. चलो कोई बात नहीं. सो वाज देयर, दीज आर द ऑप्शंस, सिरोडोसिस बल्बाई, चाल्कोसिस बल्बाई, माय डियर फ्रेंड्स. Okay, time consuming. Okay, I understand that this time the question has become lengthy. Okay, okay. So I believe if they would have asked any of these two words, then the better, safer answer is to go for this chalcosis, my dear friends, because we have talked about deposition of copper as a foreign body in our eyes is called as chalcosis. If at all this question has been asked, beta, please try to focus on the word chalcosis. I don't have the other two options. In case you remember something, please feel free to. Everybody have my number. You can please feel free to share it with me. Thank you so much. आगे बढ़ते हैं. Okay. This question was asked. This question, my dear friends. Try to look at this. Point to be noted that diet rich in pulses and rice. Now we have to mainly assume over here that mainly in this question they are focusing on some polished rice. Polished rice intake, because that's what nowadays we are mainly doing in our food habit. Muscle weakness and peripheral neuropathy, my dear friends, which of the following can be used for prophylaxis? All of you can go for the answer over here as thiamine. So thiamine से काफी सारे क्वेश्चन थे. Exact one image was magnified image of the ring. Okay, magnified image of the ring. Okay, so in this question basically kf ring magnified image, I will just put a word over here, kf ring magnified image. Okay, kf ring magnified image was actually given, beta ji. So I will include that. I hope this question everybody of you has been, basically it is a question of dry berry. Basically it is a question of dry berry, and dry berry, one of the causes that we have discussed is eating polished rice, because the aleuron layer of the rice basically contains the vitamin B1. So if you eat half boiled rice, maybe some of the vitamin B1 you will be able to get it better, but if you are eating that fully boiled rice all over, altogether it is a polished rice, so you are going to suffer from vitamin B1 deficiency. So thiamine is the answer of this question. So most appropriate prophylaxis में हम लोग इसको मार्क करेंगे. I believe in this question any tingling sensation was mentioned, beta. Did they mention any word such as tingling sensation or pins and needles? In case it comes into your mind, only polished rice given. No, pulse actually many people told, beta. Many people actually told that both of these has been given, rice and pulses. Rice they did not tell it as polished rice, but we assumed it as a polished rice. Yes, different people remember it differently, beta. But the more or less the essence of this question. Chalo, one more question we are able to mark it right. Okay. Okay, no tingling. Okay, no tingling. I will mention. Thank you so much, beta, because I also had doubt about that. So no tingling was actually mentioned in this question. Thank you so much. Thank you so much. No tingling. Okay. Yes, this question was definitely asked. Question number 12, beta. Hope you would have got this one correct. Just to make the essence, I have tried my level best to keep it intact, but the language might be different. So the essence we should try to focus. Okay, this was the essence of this question, and try to approach the essence. Do not go by the words. It might be different, and it will be different, better, but the essence will be intact over here. Money tingling and numbness was also given. Oh my god. I totally understand that recalling the things in this time's exam was a challenge. Tingling and numbness was given. Okay. चलो कोई बात नहीं बेटा, कोई बात नहीं. आंसर विल रिमेन एज विटामिन B1. ओके, आंसर ऑफ दिस क्वेश्चन जल्दी से बोलो. आंसर ऑफ दिस क्वेश्चन बेटा. आंसर ऑफ दिस क्वेश्चन बेटा जी, बेटा जी, बेटा जी. आई होप यू वुड हैव गॉट दिस वन करेक्ट. Hypoglycemia in between feeds. evidences of ketosis and lactic acidosis on ABG, massive hepatomegaly, liver was palpable 8 centimeter. Yes, people have told me this figure 8 centimeter below the subcostal margin, massive hepatomegaly beta, massive hepatomegaly. Most likely it will be diagnosed as beta von Geer's disease, that is the type 1 glycogen storage disorder. Yes, this is the option that they had given. I hope I have recalled the options correct. Lysosomal, Niemann-Pick. There was mention of hepatocellular carcinoma. Carcinoma also thinking about the enlargement, but this much of massive enlargement, it is going to be the glycogen storage disorder. Glycogen storage disorder. So please remember, I hope all of you would have got this one correct. GSD, von Geerk disease, type 1 GSD was the answer of this question, my dear friends. I hope all of you have got paper 1, my dear friends. I hope that you guys definitely have done biochem MCQs correct, which will definitely make you pass better. This time biochem in the paper 1 has become a life savior because the questions were mainly direct. Baki subjects, my dear friends, little bit twist and turns were there, but here also some twist and turns were there. But I hope you would have got the required number of MCQs correct just to pass this exam beta. Thank you so much, thank you so much. And in our classes at MIST, we have also discussed about these words: fasting hypoglycemia. Look at the number of star marks beta. Von Geerk disease, I told you, expected question area. Fasting hypoglycemia, lactic acidosis, ketosis, these things were mentioned, my dear friends. And I told you to remember this image: pot belly, massive hepatomegaly, subcostal margin 8 centimeter below, exactly what we have discussed in our classes. 6 to 8 centimeter with our naked eyes diagnosis, pot belly. This is the enlargement of the liver, my dear friends. Von Geerk disease, answer will be glycogen storage disorder. Hope you would have got this one correct beta. Doll like faces, those things they have not mentioned, but I hope you have done enough to pass, my dear friends. Question number 13. Question came on something called as beta intracellular antioxidant beta. Intracellular antioxidant also helps in the reactive oxygen species, my dear friends. In this question, many of you have told me the options were like this: copper, zinc, glutathione and peroxidase. In this one, the safest answer will be to go for beta glutathione. Yes, glutathione will be the safest option over here. See, many of you might be confused with peroxidase as well, because peroxidase can also remove the hydrogen peroxide, but few peroxidases like myeloperoxidases, MPO, they can also further go for production of the free radicals or oxygen species as well. So all peroxidases are not good. Like glutathione peroxidase, it might be good, but myeloperoxidase, my dear friends, they can also lead to production of oxygen species. Copper and zinc, copper is a transitional metal, it can go for production of free radicals, so copper cannot be the answer. Similarly, zinc is also not possible. Glutathione is the safest answer to be marked over here beta. C is the answer of this question. In this question, few of you told that they had asked about some vitamin needed, or they had used the word as respiratory burst. Does it ring any bell beta? In that same question, did they mention about something like this beta, respiratory burst? Did they mention about these words in this question? Language: intracellular antioxidant, removes reactive oxygen species, participates in respiratory burst. Was there any mention of the word respiratory burst? Okay, I will also include that question beta. Thank you. Patho correlated question, glutathione. बेटा जस्ट इतना बोल दो, was there any mention of respiratory burst in this question, and was there any mention of vitamin needed in this question? Just try to recall, just try to remember beta. I know I'm asking so much help from you guys after the exam, although the exam did not go as per plan, but just try to help me beta. Was there any mention of these words, respiratory burst or vitamins needed in this thing pathways? Then the answers might be tweaked to some extent. If not, let us try to go for the, let us try to go for, okay, so at least one of you told me that no mention of these words were not there. Okay, thank you so much beta, thank you so much. आगे बढ़ते हैं. Question number 14. Yes, this question was asked. This question was asked. Little bit overlapping question, but some of the points we have also discussed during the classes. No respiratory burst. Thank you so much. No respiratory burst. There was a mention of a old age patient hailing from Assam. ये क्वेश्चन था. Hailing from Assam, my dear friend, presents with something called as beta genu valgum. Genu valgum with the help of a stick. With the help of a stick. There was a question on glucose 6 phosphatase and glucose 6 phosphate dehydrogenase. Oh my god, in case any one of you remember the exact question on the G6PD beta, please try to help me with that as well. What about the question answer of this beta? He also reported that the other patients in the same village are also suffering from the same condition, my dear friend. This, my dear friends, actually it is due to the skeletal fluorosis beta. Here the answer, safest answer to be marked as beta, skeletal fluorosis, because there is a history of that endemic in that zone over beta. Skeletal fluorosis might be one of the answer over here beta. Image was also given. Okay, thank you so much. Like image of what? Image of what? Image of a person working with stick. अच्छा ठीक है, चलो ठीक है, एक बूढ़ा आदमी स्टिक लेके जा रहा है, ठीक है. इमेज ऑफ दैट पर्सन वाज आल्सो गिवन. ठीक है, इमेज ऑफ पर्सन, इमेज ऑफ द पर्सन वाज आल्सो गिवन. थैंक यू सो मच. ओके, आगे बढ़ते हैं. I hope, yes, this is the question many of you were waiting for that hyperammonemia question. Urea cycle disorder, there were two questions beta. Two question, yes. Urea cycle disorder, two question. Marfan syndrome, two question. Wilson disease, two question. Yes. Expected question areas, multiple thing. Water in fluorine. Water in fluorine. Okay, water. Person's image. Water with fluorine. Okay, what? I mean the option of were like this. Okay, thank you so much. Water in with fluorine, sir. Okay, thank you, thank you, thank you, thank you, thank you. Got it. Okay, answer of this question. This has come exactly from our notes. That expected question page area. Urea cycle disorders, my dear friends. Hope all of you have got this one correct. Answer of this question, beta. Poor feeding, vomiting, lethargy, hyperammonemia, glutamine levels in serum, urine analysis showed orotic aciduria, most likely enzyme defect. I hope all of you would have got with the answer of OTC, ornithine transcarb amylase beta. This is the type 2 hyperammonemia. CPS1 was the type 1 massive, उसमें हम लोग ज़्यादा कुछ कर नहीं सकते. Argininosuccinate or argininosuccinase deficiency is not that dangerous. OMP synthase, my dear friends. See here the question also they have asked on orotic aciduria. Point to be noted, the orotic aciduria can be of two types. Orotic aciduria can be of primary, can be of secondary. Primary orotic aciduria, it is actually the defect in the pyrimidine synthesis pathway itself, whereas secondary orotic aciduria might be a defect of the urea cycle disorders beta, like in case of we have discussed that type 2 hyperammonemia. Because my dear friends, we have discussed whenever the OTC enzyme is defective, just try to recall that excess carbamyl phosphate that will pile up inside the mitochondria will now jump into another pathway of pyrimidine synthesis, and it will go for overproduction of pyrimidine, and as an intermediate of the pathway, orotic acid will be also increased over here and it will be released. So in case of this urea cycle disorders, ammonia is not released in the urine as urea, rather it is released as orotic acid in the urine, and orotic acid rise, my dear friends, in this case it is mainly secondary to urea cycle disorder, because in the question they had mentioned about hyperammonemia and the glutamine levels increasing in the serum, right? Please try to understand. Important point, try to focus on this beta G. Important point, please remember pyrimidine and the urea cycle disorder. Point to be noted, OMP synthase deficiency actually also lead to orotic aciduria. Orotic aciduria, my dear friend, and this is actually a defect of the pyrimidine synthesis pathway. If it is pyrimidine If it is pyrimidine synthesis pathway is defect, then OMP synthesis can be also marked as the answer. Remember, OMP synthesis is actually a bifunctional enzyme because it has got two type of enzymatic activity. One is called as OPRT, orotidine phosphoribosyl transferase, or the same enzyme has got another activity called as OMP decarboxylase. It has got two different type of enzymatic activity. Even these enzyme deficiencies can also lead to orotic aciduria, but here along with orotic aciduria they had also mentioned about hyperammonemia over here. So we have to think about, it is a case of secondary orotic aciduria. ये जो क्वेश्चन था ना बेटा, it is a secondary, I told you, secondary orotic aciduria, type 2 hyperammonemia, OTC deficiency. And in this urea cycle disorder, out of 6 we have discussed only about those 3 which are important. I told you type 2 has been asked as latest question. It is the most common type in India, and we have also discussed about glutamine, orotic aciduria over here. Please try to remember. And in that same question, another urea cycle defect, answer was that ORNT1 defect. That is another question, but ornithine transporter 1 defect. Yes, many of you are also putting transporter defect. It is a different question over here. And in this case, what happens, beta G, after conjugation with lysine, there is release of homocitrulline in the urine. Homocitrulline in the urine. And please remember, this is another question. Question number 16. Same topic. Urea cycle disorder. One more question has been asked. Look at this question, beta. Presented with tremors, slurred speech, hyperammonemia, raised homocitrulline level in the urine. Homocitrulline level in the urine. My dear friends, they have asked about the transporter defect. In this one, the answer best we have to mark it as ORNT1, ornithine transporter number 1. Cysteine transporter defect, it leads to cystinuria, cysteine transporter defect. Option number 4, I did not get time to recall this beta. In case any one of you have some idea what are the options, you can also share it with me. Anyhow, the answer of these questions will be remembering as ORNT1, ornithine transporter 1. I hope it is crystal clear to all of you beta. So this is another question that has been asked from the same topic beta. ये दो question था from the topic of urea cycle disorders, right? One was the enzyme deficiency, that was ornithine transcarbamylase or ornithine transcarbamylase or OTC, carbamyl transferase, and the second question was on the transporter, that is ornithine transporter or the ORNT1, ORNT1, right? Important post. आगे बढ़ते हैं, question number 17. Yes, this was a tricky question, but those of you who had attended our protein metabolism class nicely in our missed online offline both classes, you would have definitely got this one correct. Yes, this question was there beta, ये question आया था, and I hope all of you would have been able to remember this and you would have definitely got this one answer correct beta. इसका आंसर बोलो. Question number 17. Please try to remember the answer beta. नो बेटा, इस क्वेश्चन का आंसर एक्चुअली मार्फेन नहीं है. प्लीज ट्राई टू रिमेंबर बेटा जी. इन दिस केस द सेफेस्ट आंसर टू बी, see, it will depend on the options. The option that I have got in this one, try to follow. The answer of this question will be beta homocystinuria, but people told in the option instead of nuria they have used the word as homocystinemia. Basically, try to recall in our sulfur containing amino acid metabolism. In our sulfur containing amino acid metabolism classes, we had discussed that there are altogether 3 vitamins which are required in this pathway. B6 is required for the homocysteine to go towards cysteine, and homocysteine to methionine conversion is required by B9 and B12. Now they are telling that the patient is having deficiency of all the 3 vitamins. That was the question. B6 deficient, B9 deficient, B12 deficient. So try to understand here. His plasma vitamin showing folic acid, B12 and B6 all are low. And if everything is low, my dear friends, you might give multivitamin supplementation, but as homocysteine is actually so toxic type of substance, it will not be able to recover itself. In that case, we also need to give one more supplementation we have discussed, tablet of betaine, BETAINE, trimethyl glycine. We also try to give to get the desired result. Only multivitamin supplementation is not going to treat the patient. You need multivitamin supplementation. Along with that, you also give tablet B10 and as well as you give high cysteine or high cystine diet. Three-prong approach we have discussed, treatment of homocystinuria. So in this question many of you also were confused with one more word beta, हम लोगों ने डिस्कस किया था folate trap. आपको याद होगा, we have also discussed about folate trap, and folate trap was also given as one of the option. See, what is folate trap? Folate trap is vitamin B12 deficiency causing B9 deficiency. So if the answer was folate trap, by giving B12 and B9 as a combo, the patient would have recovered. But here the essence of the question was that there was no improvement beta. This was the master stroke. Patient showed no improvement after giving folic acid, B12 and B6, which were all low. That means it is a case of type 1 homocystinuria beta, which is requiring three-prong attack, three-prong approach to treat the patient beta. ये थोड़ा सा प्लीज रिमेंबर इंपॉर्टेंट पॉइंट्स, इसको थोड़ा सा देख लीजिएगा बेटा. होमोसिस्टिन्यूरिया माय डियर फ्रेंड्स, होमोसिस्टिनीमिया, ओरोटिक एसिड्यूरिया, फोलिक एसिड, मार्फन syndrome my dear friends, B9 B12 not that much correlated over here. Please remember, it was a tricky question, but those of you who had focused on this pathway in this cycle, we have also talked about this. Now question number 18 my dear friends, this question was also there. Question number 18. Yes, they had mentioned about wrist widening, cupping, symptomatically fine. Yes, these three words were there. Wrist widening tha, cupping tha, symptomatically fine. Now they had asked that once the routine investigation was done, plasma vitamin level was found to be low. What is the immediate management that has to be done for this boy? Options were wait and watch, sunlight में खड़ा कर दो, sunlight exposure, vitamin D supplementation. I would definitely like to go ahead with vitamin D supplementation, but I hope all of you would have definitely chose this. Sunlight alone, wait and watch is not the option beta. We have to go for vitamin D supplementation because vitamin D actually has to be found as low. Nowadays many tablets are there, uprise D3, some course is there for 6 months, 4 months, then 1 month like that. Please try to remember beta, this is the one that we need to follow. Vitamin D supplementation has to be given in this patient. I hope I have got feedback about these three words beta: wrist widening, cupping, symptomatically fine, vitamin D was to be low. What is the next immediate management for this? If these are the questions, this is the thing that they have given, then vitamin D supplementation must be done immediately. To it is a case of ricket, it has not been ricket as of full fledged, but it can be prevented to some extent by giving the vitamin D supplementation. In this question I have asked the students, they told that there was no mention of any alkaline phosphatase level, there was no mention of any calcium level. They had mentioned only about this wrist widening, cupping, symptomatically fine. In case Dr. Ashu you try to remember anything else, try to remember this and also share it with me. Okay, catalytic activity, this was a question my dear friends, of an enzyme can be measured by. Catalytic activity of an enzyme can be measured by. This question was there. Options were Km by Vmax, Vmax by substrate, Km by substrate, and Vmax by Km. Exactly this portion was given my dear friends, and the right answer for this question is option number D, like we speak it in our classes. Vmax by Km is the right answer of this catalytic activity. Remember beta, the catalytic activity of an enzyme is actually denoted by something called as Kcat, but Kcat is a PG level topic. In our discussions what we have studied, point to be noted beta, see, Km is substrate concentration at half maximum velocity, and Vmax mainly depends on the total number of enzyme that will make you the top speed. Point to be noted, the catalytic activity, basically try to understand, it is dependent on a fixed thing, that is the number of the enzyme that is fixed. Substrate concentration can vary, but one thing that is fixed, that is the enzyme, and enzyme determines the Vmax, that is the catalytic activity. In absence of this Kcat, if it is not there in the option, then the best answer to be picked up over here will be beta Vmax by Km. अगर ये option में दिया हुआ है, this will be the right answer beta, Vmax by Km. This is the right answer of that question, Vmax by Km, because Vmax, maximum velocity, catalytic activity, catalytic कितना कर सकता है reaction, maximum it is able to reach till how much. That's why Vmax is better. To achieve that Vmax, how much substrate is remembered required, that is Km. But Vmax is over here, is the boss over here, because the number of enzyme, my dear friends, will be constant. I believe all of you are confused between only these two options, Km by Vmax or Vmax by Km. The answer over this question will be Vmax by Km beta, because Vmax, my dear friends, often remain fixed. Km can change depending on the substrate, but Vmax, my dear friend, will remain constant. Remember, Vmax cannot be increased in our normal physiological purposes because the total number of enzyme is constant. So with that concept, Vmax has to be chosen as a better. So Vmax has to be given preference. That's why the ratio will be Vmax by Km. Vmax by Km. Right. Coming to number 20. Coming to number 20. Coming to number 20 beta. This question was there. Yes, it might be an overlapping question with medicine also to some extent, but I believe they would have definitely given something called as discoloration of the sclera, lethargy, weakness. Total bilirubin was 14.1 and conjugated, my dear friends, on the higher side. Please try to understand significant ALP rise. Please try to focus over here. Crigler-Najjar syndrome, unconjugated hyperbilirubinemia. Biliary atresia also like that. Gilbert syndrome also, my dear friends, unconjugated bilirubin rise. Conjugated bilirubin rise, my dear friends, that means conjugated hyperbilirubinemia, my dear friends. Try to remember better. This is going to be either Dubin Johnson or Rotar. Many of you told Rotar syndrome was not there in the option. That's why by rule of exclusion, the right answer of this question will be better. Dubin Johnson syndrome. Dubin Johnson syndrome should be picked up over here better. Crigler-Najjar, Gilbert, both are unconjugated. Those are inherited unconjugated hyperbilirubinemia. This is, my dear friends, conjugated hyperbilirubinemia. Right. Important points. Try to remember this. Question number 20, Dubin Johnson syndrome. Question number 21. They had mentioned about a 10-year-old boy with kyphoscoliosis and bowing of legs. Two words: kyphoscoliosis, bowing of legs. Which of the following collagen type defect is most likely associated over here? Collagen type defect most likely associated over here. Answer, we would like to go ahead with the, I hope all of you would have got this one correct. Collagen type 1. Collagen type 1. Collagen type 1 beta. And basically here we are talking about osteogenesis imperfecta. Yes, there was a question on osteogenesis imperfecta beta with the words kyphoscoliosis and the bowing of legs. Type 2 chondrodysplasia, 3 Ehlers-Danlos, 4 Alport syndrome. Osteogenesis imperfecta, expected question topic. We have talked about brittle bone disease, blue sclera, but both things were not mentioned, but they were. We have also talked about kyphoscoliosis and the bowing of legs. Yes, these two things, my dear friends, was given. And point to be noted, we had also discussed about these images, kyphoscoliosis. We had also talked about bowing of legs. Osteogenesis imperfecta is the answer of this question, my dear friends. Hope you have got this one correct. Please remember type 1. Question number 22. Question number 22. Question number 22. Question number 22. There was a question on multiple myeloma beta. This was little bit tricky question. Lethargy, weakness, persistent low back pain, normocytic normochromic anemia, hypercalcemia. History goes on with the multiple myeloma, because in multiple myeloma the mnemonic was CRAB. Hypercalcemia, renal stones, decreased urinary output, anemia is normocytic normochromic, and bone pain, bone lesions, low back pain, lytic bone lesions, bone before bone pain, remember, can also tell you that it is a case of multiple myeloma. Serum electrophoresis also talked about. M spike, yes, M spike, there was a mention. And M spike, my dear friends, we have discussed multiple time in our classes. M band with our naked eyes on the glass slide. M spike, whenever we talk about densitometry, where we check the density of the each bands on the agar gel electrophoresis light. And they have asked which of the following combo to be done to double confirm the diagnosis, something like that. Some other blood test they had asked beta. Remember, in multiple myeloma we have all studied, it is the M band between gamma and the beta 2. Whenever we subject it to densitometry, there will be also rise of the IgG level, because in multiple myeloma we have talked that there is an overproduction of the IgG. So here basically one of the option is telling serum IgG as well as albumin. Albumin level will go down, IgG level will go up in patients of the multiple myeloma. But here one better marker is available, my dear friends. The better marker of this is actually the option number C over here, that we can go for serum beta 2 macroglobulin, my dear friend. Please remember serum beta 2, important point that we can also pick it up over here, beta. Beta 2 can be also given, my dear friends. Important point, hope all of you are getting this correct. Important point, please remember. I hope all of you are able to see this. There is no confusion in this one, but in this one, if they have given the option as beta 2 macroglobulin, such things are actually not that there. There is something called as BMG. BMG actually stands as beta 2 microglobulin, beta microglobulin. Yes, if beta 2 microglobulin has been given, beta, then we should go ahead with the option over beta, because BMG, my dear friends, will be increased over here, and albumin level, my dear friends, will be decreased over here, because actually in multiple myeloma there is also overproduction of the IL-6, and due to the IL-6 overproduction there is also low albumin synthesis by the patients of multiple myeloma. So little bit what the word they had given, beta, I believe if they have given the word as microglobulin, dekho, actually in our serum protein electrophoresis we have something called as alpha 2 macroglobulin, alpha 2 and beta 2 माइक्रोग्लोब्यूलिन. अल्फा 2 में मैक्रो यूज होता है वर्ड, बीटा 2 में माइक्रो. आई बिलीव दैट actually in the option na they would have given beta 2 microglobulin only, beta, not macro. Maybe it was a not able to recall properly, beta, all of you, but please remember they would have definitely given the option as beta 2 microglobulin, because there is something called as BMG. This is a special marker, beta. This we did not discuss much during the classes. It was a tough question, and we can do, apart from those Benz-Jones proteinuria, apart from serum protein electrophoresis, as a supportive evidence, you can go for also beta 2 microglobulin, my dear friends. Beta 2 microglobulin, and we can also go for the levels of the albumin, beta 2 microglobulin and the albumin. Yes, in case anybody please recall, I believe instead of the word macro they would have given the word as microglobulin, beta, right? I hope they would have given the option as beta 2 microglobulin. If this is given, then this combo should be given. IL-6 can be done. Remember, in case of multiple myeloma, there is also IL-6 that can be also increased. IL-6 can be also increased, beta, but albumin level will be actually going down. So beta 2 macroglobulin important. Actually it is an important prognostic marker in case of multiple myeloma, but yes, can be used for the diagnosis purpose as well. Okay, question number 22. So multiple myeloma topic, there was a question number 23, beta. Question number 23. Yes, this sort of question was asked. It took up some time for me to exactly retrieve the question ke what they have given, beta. Please try to feel free and also share feedback. 3-year old, yes, 3-year old infant rushed to emergency department with lethargy, vomiting convulsions. Yes, lethargy, vomiting convulsions and poor feeding after an episode of prolonged fasting. बच्चे को बहुत देर तक खाना नहीं खिलाया गया. Prolonged fasting, not 3 months, 3-year old. 3-year old. Please remember, workup revealed the cases to be of hypoglycemia, beta. Workup revealed it to be hypoglycemia, low ketone bodies. That means ketosis is not there. See, hypoglycemia with ketosis. There was another question we have discussed about von Gierk disease, glycogen storage disorder, but this is hypoglycemia without any involvement of ketosis, low ketone bodies. and mild hepatosplenomegaly, my dear friends. Please remember, in this case, the answer actually is going to be again the safest answer, MCAD deficiency, medium chain acyl CoA dehydrogenase. We had discussed this in our lipid metabolism class. MCAD deficiency. Remember, one of the very common disorder in India, MCAD deficiency. In this one, what happens? It is a disorder of fatty acid metabolism. Fatty acid, mainly medium chain fatty acid metabolism. Medium chain fatty acid. Medium chain fatty acids are mainly found in breast milk, but there are many other food items which are also having medium chain fat deficiency. Please remember, if these medium chain fats are not broken down, medium chain fatty acids, my dear friends, we know 6 to 12, these carbon, these are even number. If they break down, they try to give you acetyl CoA. And acetyl CoA, we have studied, it is an allosteric activator of pyruvate carboxylase of gluconeogenesis. Try to understand, if MCFA, let me just quickly write the pathogenesis. If medium chain fatty acids are not able to break down, then the sequence will be, there will be low levels of acetyl CoA. And acetyl CoA level, if it is going down, my dear friend, there will be decrease of the gluconeogenesis, because acetyl CoA is the allosteric activator of pyruvate carboxylase, the first irreversible step of gluconeogenesis pathway. That's the reason, as gluconeogenesis goes down, that's the reason this patient is now going to present with hypoglycemia and no ketone body. So it is a case of, my dear friends, sometimes people also called it as non-ketotic hypoglycemia, non-ketotic or hypoketotic. Sometimes people also use the word as hypoketotic or non-ketotic hypoglycemia. Beta, for non-ketotic hypoglycemia, the answer will be beta medium chain acyl CoA dehydrogenase deficiency. Remember, glycogen storage disorder type 1 will have ketosis. Hers disease, hepatic glycogen phosphorylase deficiency, glycogenolysis pathways defect. Again, my dear friend, to some extent it can present with ketosis. Hereditary fructose intolerance, my dear friends, HFI, this will not present this much late. Hereditary fructose intolerance is mainly seen whenever there is a weaning off from the breast milk after 5 to 6 months and you start giving fruit juice or fruit syrups. Basically over here it will be reflected after 5 to 6 months. It will not wait till that much. So here the hint was actually also on the age of the patient, that will try to rule out hereditary fructose intolerance. And my dear friends, no ketone bodies were there. That's the reason, my dear friends, here the other two, B and C, are also getting ruled out. Here the right answer, this was actually a tricky question, that's why I've kept it at the last. Beta, MCAD deficiency, आपको याद होगा, this enzyme deficiency, if it is so severe, it can also lead to SIDS. हम लोगों ने पढ़ा था sudden infant death syndrome, which is also called as cot death. My dear friends, please try to understand. ACADM gene mutation, this is ACA academ. Please remember, ACADM gene mutation, my dear friends, and this is the most common inborn error of the fatty acid metabolism. There is a controversy in India whether PKU is the overall most common or MCAD is the most common, but please remember it is the most common from the fatty acid metabolism, where there is less acetyl CoA generated by fatty acid breakdown, leads to stopping the gluconeogenesis pathway. That's the present child presents with hypoglycemia. It was a tough question. Try to remember, beta, hepatosplenomegaly can be seen. Try to remember this. I have some doubt regarding these three important points, beta. In case any one of you can throw some light whether this sort of questions were asked or not. Basically, there was some question on this lethargy after breastfeeding, bilateral cataract, associated hepatomegaly. Breastfeeding, there is no refusal word has been given, beta, but lethargy after the breastfeeding, bilateral cataract. Remember, von Gieck disease never presents with cataract. If cataract is mentioned in this question, if it is at all asked, you might be thinking about oil drop cataract over here, beta. And hepatomegaly, because in the patients of galactosemia we also have pot belly. And point to be noted, we have studied that this two problem is going to be seen only in case of classical galactosemia, which is mainly due to the deficiency of Galliput deficiency, GAL1 put gal 1 put, we pronounce it as galliput deficiency. Galactose 1 phosphate butyl transferase deficiency beta. Please remember, glucose 6 phosphatase is for the von Gier's disease. Here you do not see the cataract. Fructokinase deficiency is essential fructosuria, where there will be nothing but fructose leaking in our urine. Galactokinase deficiency can lead to cataract, but galactokinase, the first enzyme of the galactose metabolism, will not lead to pot belly. Please remember, galactokinase deficiency does not lead to pot belly. As the word pot belly has been mentioned over here, we have to choose about that culprit compound that is known as galactose 1 phosphate. That's why the answer of this question, if at all it is asked, it is Galliput deficiency, the safest answer. Few of you also told me, okay, sir, there was a question on A beta lipoproteinemia, beta. A beta lipoproteinemia, which also is a type of hypolipoproteinemia. In case any one of you remember it later after seeing this video, please try to throw some light whether they asked about what defect. Like in that case, we have to remember beta some A beta lipoproteinemia, acanthocytes, VLDL, all the B number containing apoprotein containing lipoprotein will be going down. B100, B48 goes down, chylomicron goes down. So steatorrhea, if those sort of histories were mentioned, or LDL, VLDL, IDL, or everything will be low, or acanthocytes in the peripheral blood smear, if something has been mentioned, if it rings a bell later on, please feel free to reach out to me with the A beta lipoproteinemia and hypolipoproteinemias if there was any question asked on that. And there was a question on neurolathyrism. I believe it might be an overlapping question with pharmacology, in case anybody also remember, because some question came with uh, I mean correlation between biochem and pharma. In case somebody remembers it later, please throw some light. So more or less, my dear friends, some 23, 24, or maybe 25 questions which has been asked in that exam beta, and I hope that all of you would have got the minimum required number of MCQs possible to be corrected, so that we all can pass out with the flying colors beta. So this is sincerely praying to God from the core of my heart for all of you, that once the results are out, you all are able to pass with flying colors beta. Thank you so much for giving me patient hearing during the session, and do not panic, just enjoy the moment. You have given the test, now is the time for you to relax, just hold back, watch some movies, try to cool down. Whatever long cherished dream, whatever long cherished plans you had in mind, try to achieve that before the results are out. And once the results are out, you will be passing with the flying colors. And my dear friends, sky is the limit. Thank you so much for giving me a patient hearing. In case anything is able to recall back in your mind, please feel free to share it with me. I will be all ears. Thank you so much, and goodbye to everyone. Thank you so much, beta. May every one of you pass. In case you remember anything later on, please feel free to share. Thank you so much. Thank you so much, beta. Thank you so much.